In this video, I am discussing another recall communications that is about benign nocturnal growing pain of childhood. So how it comes on task that you are talking to a mom of a 4-year-old boy who has leg pains. Investigations were normal. Diagnosis is benign nocturnal growing pain of the childhood. Here, the give the diagnosis and explain the management. These are mom is widow, dad died of the leukemia, presented in the same way, so she anxious. So remember, if it is a growing pain, we are going. That is like an information giving scenario in our mind. It can be breaking. It can be like empathic. Like mom started crying. There is a hidden agenda present. We will always ask: is there any concern? Do you have any other concern? Like that questions, because here the hidden agenda is mom is widow, dad died of the leukemia, presented in the same way, so she was so anxious. So we keep in mind that there is hidden agenda present. So how can we do that? First, I at CFP as usual introduce myself, making a repo, taking the consent, telling my agenda, attendance, and the prior knowledge. So mother, what do you have any idea about growing pain? What is that? What about your update of your child? Now I'm explaining this growing pain. Growing pain, it is a common in children, mainly in the legs, and they're harmless, but can be very painful. They usually stop by around 8 to 12 years. So, growing pain is normal in the children. That is really very much painful. It is totally harmless. It can be go away around the age of 12 years, as we tell them. So, how can I know that it is a growing pain? So, there are some criteria that support us as growing pain. What are the criteria? Criteria of growing pain are it comes and go over month, even years. The pain is aching and or throbbing in both legs. If in muscles, not joints involved. So only muscles aching and throbbing, both leg involved. Remember, in evening or night time mainly, it is more common in active children and can come on after playing a lot of sports and more common in children with flexible joints. So the criteria of growing pain, I'm again telling. So it come and go. It involve only the muscles, not joint. It occur at the night time and both leg. Remember, both leg is a severe aching and throbbing mainly night time and after playing, excessive playing, maybe activity. That's just why evening time it's developed and some flexible joints is involved. So what can I do for him? So what is the management plan if the mother is asking? I'm telling that you can gently massage your child legs, put covered hot water bottle on the painful area, give painkiller, no aspirin, encourage to wear supportive shoes, give a warm bath before bedtime. So what can she can be give message? Hot water bath before going to sleep. Still give the painkiller, of course avoid aspirin, no aspirin. And hot water bath I told you, and hot water bag also can give this water bottle. Okay. So why cause this? I heard that it is grow. So it's growing pain with growing of the child. No, not caused by growing, not clear cause, but can run in the families. So I want to reassure you, but take care of the symptoms. So we should take care of the symptoms. And also we tell mom about some red flags or warning signs in every communications information giving like constipations, bed waiting, anything, functional abdominal pain. These are commonly come information giving. Red flag keeps in your mind or warning signs some will give. If they notice that, they will seek medical advice. So what are the red flags about the growing pain? First off, the pain is in one leg, number one. Number two, if pain carries on the next morning. Number three, pain is bad enough to stop your child walking or make limping. Pain is in the joints such as knee, if associated with rash, swelling, or unusual bruising, if high temperatures, and if lose weight and don't want to eat. So the when seek medical advice, if pain is one leg, pain is so severe, it continue the next morning. There is high temperature, rash, joint pain, can't walk, limping started, losing weight, not eating food. These are the any bruising present, unusual bruising, because sometimes child abuse these are. So this is the red flags. We'll mention the mother about. Then we'll ask, do you have any other concern you want to talk me? And so shall I summarize? Because of that, I have given all the information to you. Then trusted website, leaflet, and a support group where growing pain child can be rebel, and they already grew out of these conditions. So this is all about growing pain. These are recall questions. Thank you.